Hello, and welcome to our second training video called How Does Stigma Impact Us? I'm Dr. Carrie Finley, and I'm a senior research scientist at the Center for Health and Safety Culture at Montana State University. Before working at the Center for Health and Safety Culture, I managed a behavioral health clinic serving individuals with mental health and substance use disorders. During that time, I experienced firsthand the impact stigma has on addressing these issues. This video, called How Does Stigma Impact Us, is the second in a series of 6 training videos. Other videos in this training series include What is Stigma? Where does stigma come from? How can I make a difference Part 1? And How can I make a difference Part 2? And where do we go from here? Each video in the series is approximately 7 to 10 minutes long, and we encourage you to review and discuss all 6 videos. There's a handout that goes along with each video. We encourage you to take notes and fill in the sections on the handout. Feel free to pause the video or repeat sections if needed. In today's training video, we're going to talk about how stigma impacts us. Stigma is complex, and it can appear in several different ways. We're going to explore 4 kinds of stigma: public stigma, self-stigma, courtesy stigma, and structural stigma. Exploring stigma at each of these levels will help us to be in a better position to recognize and understand stigma. But before we talk about the different levels, let's start with a review of training video 1, What is Stigma? Very simply, stigma is a strong feeling of disapproval that most people in society have about something. Stigma can generate negative attitudes about people with a condition, and these negative attitudes can lead to discriminatory practices. Stigmatization is a social process. That is, it's something that groups of people, often those in power, create towards other people. Stigma is complex, and it can appear in several different ways. So let's explore 4 kinds of stigma and the impact on us. Let's imagine that there's an individual with a certain health condition. This individual is observed by other people who then generate negative beliefs about the person based on their condition. These beliefs may originate in fear. People may then extend these beliefs to include other people with the same or similar conditions. This is called public stigma. Public stigma is the public's reaction to an individual with a stigmatizing condition. It's the public's reaction to a person with a substance use disorder, a gambling disorder, or a mental health disorder. Public stigma can result in barriers to new relationships. It can isolate individuals with a condition. It can reduce employment opportunities and reduce access to housing, and many other forms of discriminatory practices. Public stigma shows up through the pictures in our heads that we hold of others. We may believe that those with a stigmatized condition are dangerous or incompetent. It can also show up in prejudice towards a group and in discrimination. An example of discrimination might include withholding a potential job opportunity from a person with a stigmatized condition. Maybe the person isn't offered a job or is passed over for housing. Public stigma creates that social divide between those that have a stigmatized condition and those that do not. Public stigma can lead to the next kind of stigma, called self-stigma. Understanding ourselves requires us to observe and evaluate our own behaviors. It requires us to compare our behaviors and choices with others. It's natural to make comparisons. We do this every day. Comparing ourselves to others helps us to gauge our own abilities and talents. Understanding ourselves also depends on seeing ourselves through the eyes of others. Self-stigma is when we have a condition and we adopt negative beliefs from public stigma. It's essentially seeing ourselves as others have categorized us. So let's do a quick thought experiment. How comfortable would you be to go to your supervisor or your boss or your board of directors and tell them that you needed to see a doctor because you think you sprained your wrist? Now, how comfortable would you be going to that same person to say that you needed to see a counselor because you were dealing with excessive anxiety? Can you feel the difference? That is self-stigma starting to come into our thinking. Self-stigma shows up in the stereotypes of the self, agreeing with prejudice and discrimination. For example, in response to prejudice, the person might not pursue a work opportunity or a housing opportunity. Self-stigma can result in lower self-esteem, feelings of shame and guilt. It can lead to a reduced sense of hope, a reduced social support system. It can increase symptoms and decrease compliance with treatment. It can result in a person feeling isolated and withdrawing from the support that they need. Self-stigma manifests as fear of being judged negatively. It's that feeling fearful of seeking support or seeking help. It is the fear of being blamed for your illness or your condition, being afraid that someone will find out that you have a particular condition or think less of you because of it. Humiliation, shame, and guilt are important considerations in many aspects of health, particularly behavioral health conditions. Increasing shame can absolutely make things worse, not better. So let's look at substance use disorders. We know treatment can make a big difference and can help a person before he or she experiences bigger and bigger consequences because of their substance use. People can be reluctant to get help for substance use, even when they think they need it. In 2016, there were approximately 21 million Americans who needed treatment for drug or alcohol use. And yet, only about 2.5 million people received the specialized treatment that they needed. How might self-stigma play a role in this huge gap between people expressing a need for treatment and the actual number of people who get treatment? While there are a lot of different factors that play a role here, I think it's safe to say that stigma is one factor that can get in the way of early identification and early intervention. Okay, so let's continue to explore how stigma shows up. Not only may an individual experiencing the condition adopt stigmatizing beliefs, but the people immediately around them might as well. Courtesy stigma is stigma directed towards family and friends of those with a stigmatized condition. The family member doesn't necessarily suffer from a condition or the illness, but because of the condition of his or her loved one, the family member feels isolated, judged, and for some, may even feel blamed or guilty for the condition of their loved one. To illustrate courtesy stigma, let me give you an example. Let me tell you a story. My first job out of graduate school was as a therapist in an outpatient treatment center specializing in the treatment for people with substance use disorders. And one of my primary roles in this job was to facilitate a 3-day intensive family program for an inpatient treatment facility. Every other week, families would travel from a variety of different places to attend the family program. And from my time of running the family program, one theme continued to emerge in every family program that I ran. Family members over and over and again would express that they hated to be in social situations for fear that they would be asked about their loved one who was in treatment, and fear that if they told the truth about his or her addiction, they would be judged or whispered about, that they would end up feeling ashamed or embarrassed. This fear of judgment and isolation is a result of courtesy stigma. Again, let's do a quick thought experiment. Imagine you were telling your friends about your spouse or your partner. Would you feel the same telling them that your spouse or your partner had a thyroid condition as you would saying that your spouse or your partner had a mental illness? Courtesy stigma can isolate family members. It can lead family members to feel guilty, It creates a sense of shame, and it can make family members less likely to encourage treatment. A fourth kind of stigma is structural stigma. When leaders adopt laws and policies and rules based on stigmatized beliefs, they create structural stigma. Structural stigma are laws and policies and rules that limit the opportunities of people in stigmatized groups. Structural stigma can be found in businesses, organizations, the courts, government, school systems, and social services, just to name a few. These laws, policies, and rules act to codify or sustain the stigmatized beliefs. They can also create barriers for individuals, including reducing access to treatment and ongoing care, reducing employment opportunities, and increasing poor health outcomes. For example, in various states throughout the country, nurses who engage in substance use disorder treatment will permanently lose their license to practice. Certain psychotropic medications used to manage mental illness can be banned in jails, thus leaving inmates conditions to go untreated. And recently passed, but potentially to be reversed, is healthcare parity, changing the laws about what health insurance providers must cover regarding behavioral and mental health care. What are the rules in your current system that manifest in structural stigma? Unfortunately, structural stigma can appear to endorse discrimination, which can then contribute to public and self-stigma. While the consequences of policies and procedures that limit opportunities might be unintentional, they can contribute to stigma. To summarize, there are 4 kinds of stigma that we should recognize and understand: public stigma, self-stigma, courtesy stigma, and structural stigma. I invite you to pause the video here and to think about these 4 kinds of stigma and the examples that I provided to illustrate each of those. Take a few minutes to write down on your handout how you have seen public stigma, or self-stigma, or courtesy stigma, or structural stigma manifest or show up. Has stigma shown up in your own life, in your workplace, with your family, in your schools or neighborhoods, in a way that you're comfortable sharing? When you consider the 4 kinds of stigma, what is most concerning to you? What gives you a sense of hope or positive movement? If you're watching this training video with others, I encourage you to discuss your responses with a partner or in a small group. I also want to mention that at the end of this training video is a bibliography list of a variety of different publications that have been used to create this learning video. I encourage you to review the bibliography for additional reading opportunities. Research study after research study has shown the negative consequences associated with stigma. We currently live in a world where some conditions are stigmatized and others aren't, and because of this, people might not get the help they need or stick with the treatments they've been prescribed. Stigma decreases quality of life. Stigma reduces a person's sense of hope, self-esteem, and self-efficacy. This second training video in the Stigma training series talked about the different ways stigma shows up and how it impacts us. Stigma is complex, manifesting itself in different ways at the societal level, at the personal level, and in the structures that we've built. Please join us for our next training video in the series called Where Does Stigma Come From?, where we're going to dive into exploring why certain conditions get stigmatized and others don't. We'll talk about a variety of different factors that contribute to stigma. Thank you for joining me today.